thank y'all again for coming out in this weather today. I'm astonished at the number of people that made it. I'm excited about that. And thanks for letting me talk about something that's more near and dear to my heart. A little apology for some of the males in the group. Some of this is more directed towards women, but really all of it is general information that all of you should know. So it really applies to everyone in the room. And I'm sure you also have a woman who's close to you as well that you can look out for with some of these signs and symptoms that we'll learn. So we're going to talk about staying heart healthy. We're going to have a little emphasis on what women should know to stay heart healthy, but again, it's a generalized thing. Again, as she said, I'm Andrea Bryan. I'm one of the cardiologists with Carolina Cardiology, and I'm also the medical director of Heart Life, which is our cardiac rehabilitation and prevention center. This first slide, I just in introduction wanted to show you our Go Red for Women logo. That's from the American Heart Association, and we'll kind of refer to this, but this was an initiative that was started in 2004 because it was realized at that point that women's heart disease was so serious and not being paid any attention to. And no one realized how important it was, and many women, more women were dying every year than men of heart disease. And so that's kind of where this came from, and we'll show you why in just a minute. So these stats are taken from 2008, which is the last reliable census that the American Heart Association had to judge these things by. But in that year, over 4,000 women died of some sort of cardiovascular disease compared to 390,000 men. Now that number is close, but as you can see, you know, at that time we were just beginning to realize how serious this was in women. In fact, that same year, 10 times the number of women died of cardiovascular disease than breast cancer. 40,000 died of breast cancer, 420,000 of cardiovascular disease. And while I'm not taking anything away from breast cancer, it's certainly very, very serious and an important thing to raise awareness about. This just shows you, you know, how much awareness there was not for heart disease. In that year, 1 in 3 would die of cardiovascular disease, while 1 in 9 of breast cancer. And at any time, 1 in 3 women has some sort of cardiovascular disease. Now that includes high blood pressure, you know, history of strokes or many strokes, that type of thing as well, not just heart blockages. So these show you in a better picture form heart disease is that far category on the left, which says CHD, breast cancer all the way on the right, and in between is stroke and lung cancer. So as you can see in that time, although we weren't really realizing it, you know, women were having a much bigger problem with heart disease than we thought. This looks at men and women, men versus women. So the gray lines are men, the red lines are women, if you can't read that to the side. And as you can see over the years, we started in 1980 and move over to 2007 over on this side. So the gray lines are steadily decreasing because we're pushing and pushing and pushing all these signs of chest pain, pressure, you know, to men and what they should do. Whereas it's kind of not thought of still as a disease for women. So as you can see, the red lines, the women stays pretty flat, if not increasing a little bit. Then 2004, this initiative was started by American Heart Association. And as you can see at that time, between 2000 and 2007, we had a significant decrease in deaths in women from heart disease. So we can see that this was actually effective and something, yeah, we need to keep pushing and we need to keep thinking about. So this is a patient that actually was a patient in our practice who was a self-proclaimed health nut. She was a 41-year-old female. She exercised regularly. She ran all the time. She stayed slim, kept her weight within normal range, but had never had anything checked like cholesterol, blood pressure, blood sugar levels, or blood glucose levels, because she didn't think that, you know, she fell into a category of someone who would need that type of preventative care. She in fact had a father and a sister who had stents put in their heart arteries because they had blockages in their heart arteries at the young age of 50, and still wasn't doing her appropriate prevention. She still thought of heart disease as just something, you know, her father had to worry about. So one day in July, she was finishing up her run and started having really bad jaw pain, which is what you were talking about from earlier. So she went back inside, laid down on the ground. It went away when she laid on the ground. And so she thought, maybe it was nothing, maybe I need to see my dentist. But luckily she had a good friend who urged her, you know what, this could be a sign of a heart attack, let's just get you seen, and brought her on into the emergency department. So she had an EKG done when she came in, and it showed signs that she was in fact having a heart attack. So we took her up to the cath lab and did a heart catheterization. And for some of you, you may have heard that over and over, but not really know what exactly a heart catheterization is. Here in this femoral artery, which is down in your groin, we can just make a real tiny incision, almost like a needle stick, and go up into your arteries with this catheter. It's about the size of a wet spaghetti noodle. And so it goes all the way up your aorta backwards around to your heart there. Now we can even do this in your wrist. So we can do it through the radial artery, which is right here in your wrist beside your thumb, and it's an even easier recovery time. But either way, through the arm will go up here through this artery down into your heart. Either way, we can get right to the heart with that catheter and shoot a little bit of contrast dye into each one of those arteries there to light them up on our screen. So this is the big artery that runs around the right side of your heart. It's a C-shaped artery like that, and as you can see, for our patient, it was almost totally blocked right here in the middle. So when she was running and her heart was pumping and all that muscle was asking for more blood and oxygen, she wasn't getting any of it. So that's what was causing a lot of her symptoms and pain. So a stent was put in there, and as you can see here, opened it right back up, and she had really good flow to that artery afterwards. So why is it that, you know, she didn't consider that as a possibility, even though she had the family history, and why are we worried so much with raising this awareness to women and people who love women as well, to get them in sooner, be seen sooner, and recognize these things? Usually because on the whole, women show up with these symptoms about 10 years later than men do. So that means they're 10 years older, they've had 10 more years to gain these risk factors and build them up, and they're, you know, 10 more years of wear on their body, so they're a little more unhealthy at that point. Also, we'll go over some more of the symptoms in a little while, but women are less likely to have the typical chest pressure, chest pain, there's an elephant sitting on my chest, than men are. And again, when women show up to the emergency room, although we've had this increased awareness for years now, you know, there's still a lot of times that young women will show up to the emergency room and not be treated as if they may be having a heart attack because they're not supposed to be having a heart attack. So again, you know, women's symptoms differ, and especially women that are young, other risk factors that will have you present with a heart attack, not with your typical symptoms, is diabetes, and that goes for men and women. High blood sugar levels works on the nerves in your body, and so the nerves that go to your heart may not feel pain the same in a diabetic patient as in a non-diabetic patient. Again, that goes for men and women. So here, you may not be able to see some of this, so I'll read some of it out, but these are some of the symptoms that may pop up just by themselves as a sign of a heart attack. So these are all things to be on the lookout for and to get more treatment, or at least more testing done for, or at least go in and see your doctor about. Could be trouble breathing or just shortness of breath by itself. It could be an upset stomach, nausea, or feeling the urge to throw up. Many women that I've seen who have had heart attacks will say, I just was so tired. I was so fatigued and tired for a few days, and I just didn't know what it was. I thought maybe I had a viral illness, and it ends up they had a blockage in a heart artery. A cough, loss of appetite, just lightheadedness. A lot of times if women have pain and discomfort, it'll come in the form of pain in the jaw, maybe in the back or shoulders. A lot of times too, you may feel tightness in your neck. And all of those things are things to pay close attention to. Of course, the chest pain and pressure, which is classic as well. So what do you do if you start to feel some of these? Well, you call 911, and this Make the Call, Don't Miss a Beat was a national health education campaign that came up because when surveyed, only half of women said that they would in fact call 911 if they were doing this. I think it's really interesting that, you know, half of the women would do something else for themselves. They'd maybe take an aspirin or call their primary doctor, but 80% said that if that was happening to their husband or to their son or daughter or to their friend, they'd call 911. So we're going to call 911 80% of the time for somebody else, but not really take care of ourselves quite as much. So that's a really important thing to remember, and that's, I think, typical for for most women. So that's kind of, you know, what it looks like, what it could look like, and what to do if you see any of these things. So now I kind of want to switch gears and just talk for a minute. I promise it won't be too much longer, but just on what you can do to prevent that at any stage in life. And these are all, again, kind of the 7 healthy steps that are supported by American Heart Association too, and can be read more about on their website as well. But metabolic syndrome, you probably hear this from your doctor, and this, by definition, is any one of these 3 things. Now, these are, in a woman specifically, waist circumference in a man is anything greater than 40. So you men have a little bit more room to grow down here. But for women, we've got to keep that under 35. And the thought here is that if you have any of these 3 problems, then no matter what your bad cholesterol level is, because you'll notice it talks about your triglycerides, it talks about your HDL, which is your good cholesterol, but it doesn't talk about LDL, which is your bad cholesterol. So the thought is that if you have any 3 of these problems, then it puts you at a higher risk for heart attack or stroke, no matter what your bad cholesterol level is. So this is increased waist circumference over 35 inches, high triglycerides over that 150, low good cholesterol, because we want that to be above 50 for females, or a high blood pressure. And this should have a little asterisk beside it now, because we've just gotten the newest guidelines on blood pressure control, and we know now that if you are 60 years of age or older and have never had heart disease or heart attack or stroke, then your top number there needs to be under 160. So that gives you a lot more room there to wiggle and get off some of those blood pressure medications that may be making you feel so bad and costing a lot of money. And then also keeping that fasting sugar levels below 100. Second step, don't smoke. Smoking is the single biggest cause of preventable deaths that we have here in the United States. 21% of American women over 18 smoke at any time, which is 22 million women. This number obviously has gone up over the last several years as women have more entered the workforce and have, a higher stress burden and that type of thing. But, you may think, okay, I'm, 50, 60, 70, I've smoked for this many years and they're trucking along, it's going to be too late now. I can't do anything about it now. It's false. Never too late. Any lung damage that has been done, which I guarantee you is there, after even 5 years, but somewhere we think between 5 to 15 years of smoking, your risk for lung cancer can be equal to that of people who have never smoked before. Also, we think 15 years after you stop that your coronary artery disease, so all that plaque that's been laid into your coronary arteries from smoking all those years, can kind of reverse itself and you can get back to that of a non-smoker. So those are huge benefits. Also, every year, 35,000 people at least die from secondhand smoke. So you may be a non-smoker in a house where you're, inhaling smoke a lot of the times and you're still at a huge, enormous risk. Or you may be the smoker that's putting those around you that you love at risk. So it's important not just for you, but everybody around you. It's also important not just for your heart, but all of your other organs. Obviously it greatly affects all the arteries all through your body. So when you stop smoking, you deliver more oxygen, more blood to all these areas. That means better memory, you're getting better perfusion to your brain, less wrinkles, you're getting better perfusion to your skin and that type of thing, and obviously improvement in all of your organs. Another thing, maintain a good healthy weight. Your body mass index, you probably always hear BMI from your doctor. And all that is looking at your weight with taking into account how tall you are and what your age is. And so that kind of equalizes everybody for what their metabolism should be and how tall they are. And losing weight helps with everything. You may be on medicine for your blood pressure, for diabetes, for cholesterol, and a lot of times even just losing 10 pounds, you can come down some off of some of those medicines. And over time, with significant weight loss, to get back to a healthy weight, you can come off of a significant number of medicines, which is a cost saver as well. And let's not kid ourselves, we just feel better, when we lose weight. Blood pressure is an important one. We call blood pressure the silent killer because you don't feel blood pressure. If it's super, super high, you may feel it in the form of headaches or blurred vision or that type of thing. But otherwise, you don't really feel it, and all the while it's doing damage to your heart and your arteries. As many as 90% of people will develop high blood pressure by the time they get to be over 60 years old. So it's important to look at. I talked to you about these new guidelines. So now, normal blood pressure, and we gave you some papers on your table. You can take these with you too. This actually does not have the updated numbers on it, but they're here if you want to make note. Normal for anybody, even if you've had heart disease before, is less than 140 in that top number. Now, like I said before, if you're 60 years of age or older, then and you've never had any stents put in, any heart disease, anything like that, strokes, then that top number goal for you is 160. So as long as you can keep your systolic blood pressure or that top blood pressure below 160, you're doing a good job. And the reason that the Joint National Committee, which is who gives us these guidelines, has changed this is because we've seen that over the years in people over 60, it's actually been a little more harmful to keep plugging that blood pressure into the ground, lower and lower, because while it's not putting, that much more stress on your body to have a slightly higher blood pressure, it causes a significant number of less falls and less interactions between medications that you're taking. And so those are things that are always very dangerous for people 60 years of age and older. So we're pretty happy about these new guidelines. The way to manage your blood pressure, again, keep a good heart healthy diet. We'll talk about a little bit about what to do to keep a low sodium diet to keep your blood pressure nice and controlled. Physical activity, again, maintaining a healthy weight and no smoking. Limit your alcohol intake, and of course stress pushes that up a lot. So like I said before, as little as 10 pounds will take that top number of your blood pressure down. If you can lose 20 kilograms if you're on blood pressure medicine, which is essentially 10 pounds, then that top number will go down up to 8 to 10 points. And so for some of you, that may take you down into the normal range and get you off of blood pressure. The DASH diet is kind of an older, tried and true diet that was developed to decrease your blood pressure, and it's focused on lowering your sodium. So you'll find a common theme in these diets that you see for heart health and for low blood pressure, and that's they're really, really rich in fruits and vegetables. Also whole grains. What you won't see on a lot of these is a lot of red meats, which are high in those bad fats, saturated or trans fats. I call those, and some of you are my patients, so you've heard this before, but I call those four-legged fats. So any animal that walks on four legs, that's a pig, a cow, a lamb, those animals have meat high in trans fats or saturated fats, and that's what lays down that bad cholesterol. I know it's good. I know it's the good stuff. And I tell my patients a lot of times, I know if I tell you don't ever eat it again, that's never going to happen right now. But you can decrease to at least, once, maybe twice a month, and still be okay. Let that be your reward for having a good week of a good diet. Also, you want to, those trans fats and saturated fats are in any products that come from those animals. So you want to decrease the amount of full dairy products that you take in. If you're going to eat, cheeses and yogurts and things, you want them to be low fat, 1%, 2%. That includes milk as well to avoid all of those saturated fats. Sodium restriction, obviously, you all know, helps with blood pressure control. And alcohol, especially in women, is restricted to 1 drink a day. In men, that's 2 drinks a day for keeping blood pressure down. So you may be, I saw that. So in the grocery store, you may be saying, I'm doing the right thing. I'm getting all of these canned vegetables, eating these at home. Why is my blood pressure staying up? The sneaky thing is that canned vegetables have lots of sodium built into them to give them a better shelf life. So always when you're making your vegetables at home, it's okay to get them, just put them in a colander and rinse them through really, really well. That'll take off at least a third of the amount of sodium that's added in to pack them. Also, make sure you're comparing brands and comparing even the grocery store brand of what you're eating. I've seen chicken broth and broths that you cook soups with that have differed in their sodium content by up to over 100 milligrams per serving. And so make sure that you're comparing brands that you see on the shelf. Also watch out for recipes. A teaspoon of salt that you put in a recipe, you're adding 2,100 milligrams of sodium. And your goal every day is to keep that less than 1,500. So you've already added into that recipe more than your whole daily content. And then you'll see a lot of times low sodium versus reduced sodium products. The take home from this is you really always want to choose low sodium over the reduced. Reduced means by the FDA guidelines, it's got to be 25% less than what the original product is. Low sodium means that in one serving, it can have no more than 140 milligrams. So if you get a low sodium and you eat one serving of that food, you know exactly the amount of sodium that you're getting from it. It cannot be more than 140. So another thing, obviously, control your cholesterol levels we've talked about. Now, all of you in this room probably have had your cholesterol numbers checked, but as in our example patient who was already 41, she'd never had her cholesterol numbers checked and may have realized that this is something that she inherited and we could have fixed before she had the heart attack or the blockage in that artery. I've starred the LDL, which is your bad cholesterol. 130 is kind of a blanket statement number to try and get below, but if you've had heart disease before, if you have diabetes, then your number is actually much lower than that. So this wouldn't be right for you, but that's just kind of a general. Like I said, women even 20 years of age can inherit this, and so it's important for everyone, no matter their age, to have this measured after, of course, 18 to 20. And it's prevalent in at least half of our population of women in the United States over 20 years old, and I imagine that'll even increase as time goes on with, unfortunately, how we're fed from our fast food and dairy companies. Also, menopause is kind of a tricky thing with your cholesterol levels, because before menopause, you do have a slightly protective effect coming from your estrogen, whereas you kind of lose that after menopause. So usually you want to have your numbers rechecked after you go through menopause, because your LDL can go up and your good cholesterol certainly usually goes down. So that's when you got to incorporate a few more things to help that go up, like exercise and that type of thing. Sugar levels, of course, those have probably all been checked by your doctor. Anything below 100 is normal, and over 125 is diabetes, and those are fasting. Also, if you had gestational diabetes with your pregnancies, then you're at a much higher increase of developing, you're at a much increased risk of developing type 2 diabetes at any point later in life. So if you've had gestational diabetes, then you always want to keep having those numbers rechecked just to be sure that's not something that's cropping up. Some symptoms that you may notice if your blood sugar levels do elevate is constant thirst. When your body has all that extra sugar in its blood, it wants you to drink and drink and drink water to kind of dilute that out. You also will get blurred vision because it does affect the arteries and nerves that go to your eyes, and just decreased energy overall. It affects everything, diabetes does, large vessels and small vessels in your body, but the main four that we look out for are your heart, your kidneys, your eyes, and of course your brain with strokes. So this is always another thing to make sure you have in check. And you may say as well, okay, now's my time, I'm retired now, now's my time to just kind of relax. But getting active can actually be a social thing and can be something that, that gives you time to meet with friends and stay healthy as well during the day. And this doesn't mean a hardcore, you're sweating workout. This is 30 minutes a day, 5 days a week, and this is not just my opinion. This is American Heart Association guidelines, and this is National Health Organization. 30 minutes a day for cardiovascular health. This is not to lose weight. This is to keep your heart in shape and healthy. That's moderate intensity, sustained exercise. So you may think, my mother-in-law tells me a lot, well, I went outside today and picked up pine cones for 10 minutes and then came back inside and then did this for 10 minutes. And that's all great, but to keep up that heart health, you want to keep that heart pumping at a moderate rate and keep that up for 30 minutes at once. So that can be anything. That can be walking, that can be rowing, swimming, doing any sort of aerobic activity. And like I said before, make it a date. husband and wife get out and walk after dinner every night, or make a date with friends to get together, you know, in early morning or around lunchtime to catch up and kind of do some walking. Lots of local gyms have tracks, and the high schools have tracks too, where there'd be a lot of people around, you know, in case you needed anything, and you could all get out there and walk together. These are some more examples. As I was talking about earlier, you'll see this common theme here. You're not seeing any red meat. So any meats that they want you to add to these diets to stay heart healthy and to keep your blood pressure low and cholesterol will have lean meats like oily fishes, which are high in those omega-3 fatty acids, which helps protect your heart and decrease your triglycerides. Fruits and vegetables. Most of what you eat in a day should be the fruits and vegetables. If you do eat grains, cereals, rice, pasta, you want it always to be 100% whole wheat. Now, if you say 100% whole grain, which is confusing, whole grain can have any of these things in it. Almost every bread you eat is whole grain. Whole wheat is what has the lower glycemic index and does better for you from a cholesterol and blood sugar standpoint. It also has less sodium. And then again, this is the DASH diet, which you'll keep seeing the same themes over and over. So the last thing that I wanted to touch on is just hormone replacement therapy, because it's sort of been back and forth with all of the studies that have come out and whether or not it actually hurts or helps your heart. Originally with the Women's Health Initiative, this was done in the early 2000s, because in the 1990s, at least a third of all women were on hormone replacement therapy. So at that time, they studied all these women and kind of their long-term outcomes and realized that the cancer rates were going up in women who were on estrogen replacement. So at that time, they said, do not just take estrogen to help your heart. This could, you know, increase your cancer risk. And so use of hormone replacement dropped by about 70% at that time. That was in around 2002. So later on, about 10 years later, the authors thought we need to look at this again. So this estrogen for prevention study was done, and these patients took estrogen and progesterone together right after menopause and saw that it did help your cardiovascular risk a little bit, because you're adding back that estrogen that helps with your cholesterol levels. And their cancer risks long term were much less so far. Now we're only a few years out of this. But they went back to those original authors from the Women's Health Initiative and said, well, what do you think about this? Now this is the opposite. This is telling us we can maybe do it. And so I think the general practice rule that we try to use is, yes, you can use the hormone replacement therapy for symptoms for a short period of time, but it should be used for as short amount as possible with as low a dose as possible, and really not be taken long term just with the goal of thinking you're going to help, you know, prevent heart disease. So it's no longer something that we'll use long term for heart disease prevention. What kind of questions do y'all have about any of this? Anything?